I am going to review the different parts of Medicare and the different assistance programs that we have in South Dakota that can help people to pay the costs for the Medicare. So Medicare is a federal program. It is overseen by Medicare and Medicaid services under Health and Human Services. Unfortunately or fortunately, Congress makes the decisions about Medicare and the rules, and Social Security and the Railroad Retirement Office handles the enrollment. So when somebody is ready to enroll in Medicare, they have to call Social Security. So when somebody turns 65, age 65, they can apply for Medicare. Even if somebody does not start drawing a retirement check, they can still apply for Medicare at 65. If somebody is receiving Social Security disability benefits, and Bonnie already talked about this, but if somebody is receiving SSDI, then they are eligible for Medicare after a 2-year wait. That 2-year wait is a unfortunate rule, in my opinion. Fortunately, there is the affordable health care. A lot of people can and do use that while they're in their 2-year waiting period for their Medicare. People who have end-stage renal disease, they can get Medicare. Even if they're not getting disability benefits, they get Medicare. But if somebody does apply for disability benefits, then they don't have that 2-year wait for the Medicare if they have end-stage renal disease. People who have ALS or Lou Gehrig's disease, they do have to apply for disability benefits in order to get the Medicare. But once they do, they don't have the 2-year wait. So all those people are eligible for Medicare. This is the Medicare card. I have a lot of people that stop into my office and I don't have a query that identifies what they're getting. So I have to ask them different questions to figure out what benefit they're getting and what help they need and where the issue is. And a lot of people just don't even know what they get. So I just tell them to get their cards out of their billfold, and then I look at the cards, and that can help me to determine basics of what they're getting. Even if they don't have their card, I ask them if they have a red, white, and blue card, or I bring it up on the screen to try and figure out what cards they have. So there are 4 different parts for Medicare. Once somebody is eligible for Medicare, they're automatically enrolled in Medicare Part A. Part A covers hospital stays and surgeries. There is no cost or monthly premium for the Part A, but if somebody has a hospital stay or surgery, then Medicare Part A covers 80% of that bill, and the individual is responsible for 20% of that. So that can be thousands of dollars. So if I'm working with somebody and they have frequent hospital stays, or if they have a surgery coming up, then I'm going to visit with them and give them some basic information about a supplemental plan. A supplemental plan can help cover that 20% out of pocket. And then I do send people to an insurance person here in Sioux Falls, where I work, who is very familiar with Medicare and can help them with that. But a supplemental plan is something that I also visit with those people about. People are also automatically enrolled in Medicare Part B. That is for doctor appointments and outpatient care. That does have a monthly premium of $144.60 in 2020. That person also is going to have a copayment for their doctor appointments, and they have an annual deductible of $198, much less than the average deductible. They're automatically enrolled in the Part B as well, but people can opt out of the Part B. They have to sign a card and send it back into Social Security, and they will drop that for them. That is possible, and we'll talk about the consequences of that, or what somebody needs to do if they're thinking of that. But they have to purposely unenroll themselves if they don't want it. There are Medicare Part C plans. These are private insurance companies that provide coverages for a lot of different scenarios. If somebody is interested or needs to look at a supplemental plan, I will also encourage them to get information about a Part C plan. These can be a variety of different situations. They can cover the 20% out of pocket. They can take the place of A and B or A, B, and D. They're sometimes called Medicare Advantage plans. And there's different options, so there's different costs, but this could be, this should be something that people should look at as well. And then there's Medicare Part D. That is the prescription drug coverage. Here in South Dakota, there are 29 different Part D plans that people can choose from. People should pick what Part D plan that they would like based on the medications that they take and the dosages that they have for those medications. All of them have different monthly premiums, all of them have different co-payments, but again, if somebody needs to look at a Part D plan and pick one, I will send them to the insurance person that I know here in town that's very familiar with that. Or I do send people to Shine a lot of times for help with this. They do this a lot, and so they're very familiar with this and can help people to find a really good plan. So those are the 4 different parts of Medicare. Now, here in South Dakota, if somebody is signed up for one of these 3 programs, then they can get help to pay their Medicare costs. So if somebody has, oh, I'm sorry, I'll go back. If somebody has full Medicaid, if somebody is participating in the Medicare Savings Program, or if, or there's also the Part D Extra Help Program that helps pay the different costs. We'll talk about Medicaid first. So if somebody has full Medicaid, then that full Medicaid covers all or almost all of that person's Medicare costs. So if somebody has Medicaid because they are SSI eligible, then that full Medicaid covers all of that person's Medicare costs, all of them, outside of a very small copayment for medications, $1 to $3. And if somebody has a hospital stay, usually they get no bills at all, but they could get a $50 bill. That's the most that somebody would get if they had full Medicaid. Other than that, it pays all of their Medicare costs. If somebody is getting full Medicaid because they are participating in an HCBS waiver program, the Choices waiver, the Family Support waiver, the ADLS waiver, or the HOPE waiver here in South Dakota, then that full Medicaid covers almost all of that person's Medicare costs. So that full Medicaid covers everything except the Medicare Part B cost, that $144 monthly premium. If that person's income is above a certain limit, then they could be responsible for paying their Part B cost each month. But other than that, that full Medicaid also pays all of that person's Medicare costs. So full Medicaid, if somebody has that, that is fantastic because it pays most of those costs. If somebody doesn't have full Medicaid, then people can also look into the Medicare Savings Program. There are 4 levels of this. We're going to go through each of these individually, but those are the QMB, Qualified Medicare Beneficiary, SLIMB, Specified Low Income Medicare Beneficiary, QI, Qualified Individual, or QDWI, Qualified Disabled Working Individual. So we're going to go over each of those specifics for those 4 programs. QMB, this is the best assistance program. It covers the most. And in order to be eligible for this, somebody's income must be lower than $1,063.33. And this is countable income. Now, Bonnie went over detail of what countable income is. So countable income is different than total income. So for this program, they look at all of somebody's SSDI check, but they subtract $20, that $20 general income exclusion, if you remember last week with the SSI. So they look at all of the SSDI check minus $20. But if somebody is working, they like it when people work, so they look at half of that earned income, and then they subtract a $65 earned income exclusion. So this program looks at less than half of that money from a job. If somebody qualifies for this program, then it covers it pays for the Part B premium, the $144 each month. They don't have that. But this program also covers the 20% out of pocket that somebody would have if they had a hospital stay. It also covers the annual deductible for the Part A and Part B, and it covers the co-payments. So this program covers a lot. And so if I am working with somebody and they want to go back to work, and I know that they are going to lose this assistance program, then that doesn't mean that they shouldn't work. What that means is that I'm going to visit with them about the supplemental plans that are available out there, or the Medicare Advantage plans. And so I will visit with them about that. And a lot of times I'll help them to call that insurance guy that I know to make sure that they get that information, because he'll sit down with them and go through those different plans. Some of them people can get for $70 to $100 a month. So if somebody loses this assistance program, but can get this coverage through a $70 insurance policy, great. If they are going to make $1,000 from a job, they're still ahead. And so we want to talk about all of those things. Somebody can also have up to $7,860 in the bank resources, or $11,800 for a couple. So they can have a little bit of money in the bank. If somebody isn't eligible for that, then maybe they could look at the SlimB. In order to be eligible for this, they have to have income that's less than $1,276 in countable income. Again, the resource level is the same. But if somebody receives this assistance, it only pays for or covers the Medicare Part D premium. And I say only, but if somebody has limited income, $144 is a lot. It's a lot of money. So if somebody can save that each month, fantastic. So if somebody doesn't qualify for that, then we're going to look at the Qualified Individual Program, the QI. This one has a higher countable income limit. People can make more and still qualify for this one. The resource levels are the same. This again covers the Part B premium, but there are a limited number of slots available for people in South Dakota, a limited number. I don't think that they have ever reached that limit and had to turn anybody away, but there's a limit. And so people have to apply for it and hope there's a slot each December. Now, because there's limited slots, that person who gets Medicaid, full Medicaid through an HCBS waiver program does not have access to this assistance program. The reason is because there's limited slots. And so that person who has Medicaid gets all of their other costs covered. And so they're going to save these limited slots for that person that doesn't. So that's why a lot of people that I work with who are getting the HCBS waiver still does have to pay that Medicare premium. But again, they have full Medicaid. That's the only cost that they have. So last, we're going to talk about the QDWI. This program, I don't know if anybody's ever used it in South Dakota, but yet it is available. So this program pays the Part A premium for people. Now earlier, if you remember, I said that there is no cost or premium for Medicare Part A, and there is not. There is not. If somebody's getting their check and they're getting Medicare, there is no premium for the Part A. If somebody works themselves off of the SSDI check, then they still can keep their Medicare through the extended Medicare program, but they still don't have a Part A premium, so still no premium. But once somebody exhausts or uses all of their extended Medicare, which is up to 7 years after their trial work period, 7 years after their check stops, then they can still keep their Medicare. They just have a Part A premium then. And that Part A premium after extended Medicare is about $458 a month. So it is quite a bit. So if somebody is in that situation, this program can help pay that Part A premium. And this also has an income limit of, I think it's about $2,100 a month. The resource limit is ironically lower than the other programs. And this program does not cover the Part B premium, just the Part A that nobody ever has until they have extended their extended Medicare coverage. I have had 2 people that have reached this. They have exhausted all of their extended Medicare. That's fantastic. But those 2 people were utilizing the MAUD program, and we are going to talk about that next week. MAUD gives people full Medicaid if they're working and if their unearned income is below a certain amount. So those 2 people had MAUD, and so they were technically ineligible for Medicare then. So they didn't need to sign up for this, but this is available. This is available for people. Earlier we talked about the Medicare Part B. It is private drug plans, and there are 32 different options for people. All of them have different premiums. All of them have different co-pays, but all of them have a limit as to how much they're going to cover for each individual. They have a total out of pocket that they're going to pay for. If somebody has Part D coverage, and if they have high medication costs, they could hit what's called the donut hole. The donut hole is not anything good. It's very bad. Once somebody's insurance company, Part D insurance company, pays as much as they're going to out of pocket for that person's medications, and I don't even know what that amount is. But if somebody has medications that cost $10,000 a month, $20,000 a month, they're going to hit that donut hole at some point. They're going to hit that limit as to what that insurance company is going to pay. So once they do, they've hit that limit, then the insurance stops. No more insurance, they're not going to pay anything. So that person has total out of pocket for their medications for a certain number of months until they hit a catastrophic level of out of pocket costs. And I don't even know what that is either. But if somebody's medications are $2,000 to $20,000 a month and they don't have insurance coverage, they can't afford their medications. So that is a big deal. And so the program available for people to help pay their Medicare Part D costs is called the Extra Help. It helps people to pay their monthly premiums, their co-payments, and their annual deductibles. But if somebody gets this extra help, then they don't hit the donut hole. They don't have it. And so the donut hole and the Extra Help program is a really, really big deal. And so that is something that we are going to review with people as well. We're going to go over their medications and their Part D and how income is going to affect their eligibility for this program. So there are 2 levels. There's the full and the partial. Full Extra Help does pay that person's monthly premium. It pays their annual deductible, and then they have a small co-payment for their medications. If somebody has the partial help, then their premium is dependent on their income, pays part of their deductible, and then they just pay 15% of the co-payments for those medications. And again, people don't have the donut hole. So if I am working with someone and they do have high medication costs, then I am going to send them to Shine so that they can figure out whether or not the donut hole is something that they need to be concerned about. If not, great, then they're going to be fine. If, however, they find out that they are going to hit that donut hole, then I'm going to have them come back, because then what I'm going to discuss with that person are the grace periods or timelines where they're going to keep the extra help even though they have that extra income. When somebody starts working, they can keep that extra help for 6 to 12 months after they lose that extra help because of their income, or once their income is high enough to where they are above the extra help limits, they still get to keep it for 6 to 12 months. And so that person still does have the opportunity to try working, still keep that extra help. If that job works out and they continue to work, then I want them to come back 2, 3, 4 months before their extra help is going to end, so that I can give them detail of what that means, so that they can make choices and what their options are and what they can do about it. Unfortunately, there is no supplemental plan that people can get to help with the donut hole. There's nothing like that. So this is a big deal that we are going to visit with people about when we're sitting down with them when they're getting ready to work. So if somebody is getting full Medicaid, they automatically have the extra help. Fantastic. If somebody is getting help from one of the QMB, the SlimB, the QI Medicare Savings Program, they're automatically enrolled, automatically get the extra help. Fantastic. But if somebody isn't in one of those two situations, then they can fill out an application. And again, if I am sitting down with somebody and they need to fill out that application, it's fairly simple, but I usually do send them to Shine. Shine fills out that application all the time. They're going to know some of the detailed answers to some of the different questions. And they're most familiar with it, so they should absolutely help them with that application. But I believe that Medicare sends out these applications every year so that people don't miss it. So earlier, I told you that people are automatically enrolled in Medicare Part B, but somebody can decline it if they would like. If somebody does decline it, and I've had people do it just because they say I can't afford it, or they say, you know what, I never go to the doctor, I'm gonna get it later. But if they decline it and then want it later, they have a 10% penalty for each year that they went without it. If somebody does not enroll, whether it's on purpose because they don't want to pay that extra premium, or whether it's by accident because they didn't know that they had to enroll, then they have a 1% penalty for each month they went without that Part D, if they do want it down the road. Declining any of these parts is a big deal, but some people do because they have other insurance coverage. They have private insurance, and so that's fine. If they can identify that they had credible coverage during that time that they declined it, then they just have to give that detail proof to Medicare, Social Security, and they won't have that penalty. Veterans benefits and Medicaid, those aren't credible coverages, because some people that I work with, if they have Medicaid, they will say, you know, I don't need Medicare, I don't want it because I have Medicaid, it covers everything. But if somebody has Medicaid, Medicaid is the payer of last resort, and that is what Tynell was talking about last week, payer of last resort. So once somebody becomes eligible for Medicare, they need to take that. And if they don't, if they decline Medicare, then Medicaid won't pay. Anyway, the Medicaid is not credible coverage. The veterans benefits is not credible coverage. But again, people who have Medicaid, most of their Medicare costs are covered. So that's what we're going to go over with that person. But I have sat down with people who have declined it. They didn't know that. They didn't know about the penalties, but they qualify for QMB. They could qualify for either of those programs. Then they can sign up for the Part B or Part D without those penalties. So that has saved a few people that I worked with a bunch of money. So as Bonnie was talking about, people, when they go back to work, they want to know what's going to happen to my check, but they absolutely want to know what is going to happen to my medical coverage. I don't want anything to happen to my Medicare. I need that coverage. So we have nothing but good news for them when we sit down with them. So if somebody is thinking about work, they want to work part-time, if their income is below that SGA amount, $1,260 in 1 month, they're going to still get their SSDI check. If they're getting their SSDI check, then they're going to continue to have Medicare, definitely. Their costs might change, and that's something that we're going to discuss with them. But if they're getting their check, Medicare is going to continue, absolutely. But even if that person is thinking of working full-time, even if they want to work full-time, they know that their check might stop, then we also have great news. Their Medicare can continue through that extended period of Medicare coverage. Nothing but good news for them. Plus, if we have somebody who is thinking of working full-time and their check is going to stop, then we're going to also discuss with them all of the detail of MAUD, great program. We're going to talk about that next week. But they have the opportunity to look at that coverage as well. So when we're sitting down with somebody, we're going to go over that Medicare and we're going to go over those costs. Like I said, if somebody's going to lose the QMB, I'm going to go over some of the different supplemental plans, but they might be eligible for one of the other higher Medicare savings programs, so they won't have that $144 cost for the Part B plan, and then have a supplemental for $70 to $100. They're still going to be in really good shape. They can still take that job. Going over the extra help, big deal, like I said before about the donut hole. When we go over that, in most cases, people are ahead, but that's why somebody should sit down with a benefit specialist just to go over that, because it's a lot of stuff. And the Medicare is really important. One more. So when I meet with somebody and they are just becoming eligible for Medicare, some of them do have private insurance, whether it's through their parents or a spouse. And people can definitely have both. When somebody has private insurance, then that Medicare can be the secondary coverage for that person. But if somebody's private insurance premium or deductible is really, really high, then that Medicare is probably going to be a better option. Now, if they look at a supplemental or an Advantage plan that can cover almost everything for them, that the Medicare, in addition to some of the supplementals, could potentially be even better than the private insurance. So they might opt to drop the private insurance and keep the Medicare with the supplementals. And again, I do send people to the insurance guy that works here in Sioux Falls that is very familiar with Medicare, the Part D plans, and the affordable health care. So I'm pretty lucky to have that person to send people to. And then go over the different options. If they do decline the Part B and D and they have private insurance, then that's usually credible. So they can do that. They just have to get information from their private insurance agent as well. Sit down with all of us and go over it. And I think that is the end of my slide.
Okay, Rhonda, we do have a couple of questions in the chat. I'm going to read those and we'll open it up then for other questions. If someone declines coverage because they either don't understand it or can't afford it, should we refer them to a benefit specialist or Shine to help them get on?
Yes, you should definitely have them come talk to us, because like I said, they might, on first glance, they might see, oh, you know, the Part B costs $144. You know, I can't afford that. Or, you know, the Part D, you know, I can't afford anything. I can't afford anything extra each month right now. How am I going to afford that? But like I said, there's those different programs that can help people to cover those costs. And so if they don't have, well, maybe they have full Medicaid because they're working with a community support provider. I mean, they're going to get enrolled in it anyway, and they're going to have that help anyway. But they might not know about the Medicare savings. And so we're going to help them to get that information and help them to sit down and go over all of those numbers, so that we can definitely help them to identify, can you afford it or not, but then give them the bad news that they might have a penalty if they want it down the road. Yes, we're going to give them all that information, and then then they get to pick.
And then the next question, Rhonda, is if someone is dual eligible, is there a need for Part C?
Part D, yes, yes. And actually, I think I'm gonna go over that in the concurrent slides next. Oh no, actually, I was supposed to mention that earlier. Anyway, yes, so if somebody is concurrent, then that Medicaid, they have full Medicaid through SSI, so that's gonna cover all of their Part B costs. But when somebody has Medicaid, they do need to take a Part B plan. DSS is going to make them do that because once they're eligible for Medicare, then Medicaid is not actually paying for their medications. People think that, but their Medicare Part D is paying for their medications and the Medicaid is paying the costs. So if they say, nope, I'm going to purposely drop the Part D plan, then Medicaid is going to say, we're not paying for your medications. They don't understand that the Medicaid is paying all of their Part D costs. So yes, they should not drop the Part D.
And she was actually asking about Part C.
Oh, C, sorry.
So I think there was a misunderstanding.
Oh,
they don't have to have a Part
no.
C plan.
No, they don't. No, a lot of people don't, and we don't see that near as much. Most people have A, B, or D. The Part Cs are something that they are a variety of different coverages, and I don't know anything about them, but no, people don't have to have Part C. Sorry, no.
Yeah, and those are often sold by other, by insurance companies. You'll see different Medicare Part C plans that are available, but yeah, some of the, I've seen elderly people have them, but not so much people with disabilities that we are working with. And then the question, Rhonda, about SHINE and the benefit specialist referral is, should they refer them to a benefit specialist or SHINE when it's somebody that declined the coverage and now needs help getting on?
Oh, either one. SHINE does a really, really good job of helping people with that, but sending them to both would not be a bad idea. The more information that they get from different organizations, the better. So I would actually say both, but if they went to SHINE, SHINE would help them with that as well.
Okay. Any other questions for Rhonda? Okay, Rhonda, you can go ahead with the next presentation.
Okay, let me do this again. Share. Okay, I will get it to. Okay, everything look good? Am I ready to go?
Looks good.
Okay. Okay, so Barry went over all of the detail and rules for SSI last week, and Bonnie went over the SSDI benefit and all the rules for that just a little bit ago. And as you guys know, there's a lot of information there. There's a lot going on. There's a lot of rules, and it's super confusing. But there are people who get both. There are people who get both benefits, and they are called concurrent beneficiaries. So if you didn't think that it was a lot of information, it was super confusing, these people have a doubly confusing situation. They got a lot going on. But yes, if somebody gets a small SSDI check, and if they have less than $2,000 in the bank, and if they have no assets or little assets, then they could get SSI as well. So they could get both. So the disability determination, the medical part of the disability determination is the same for SSI and SSDI, but the financial part of that is different for these two benefits. So most people who get SSDI get an amount that's more than $900, $1,000 a month, or they have worked throughout their lifetime. So they might have money in the bank, they might have savings, they might have a couple cars and a camper, they might have other assets, they might have a 401k, and all of those things would make them ineligible for SSI. But for those people that aren't in that situation, then they could get some SSI. If somebody is getting less than 803 in a disability check, then Social Security says, okay, well, that's not enough to live on each month. So you need a little bit more in order to live. So we're going to plug this information into that basic SSI calculation to help to explain it a little better. So the average SSDI beneficiary gets about $1,258. That's the average that people get. So even if somebody is getting that amount of SSDI and they have less than $2,000 in the bank and they have no assets, they're still not going to get SSI because their income is too high, their unearned income. So let's just take that number and plug it into the SSI calculation. You take that that check amount, $1,258, and apply that $20 general income exclusion. Their countable income is $1,238. So you subtract that from that federal benefit rate, the top SSI amount that anybody can get, and of course that's negative. It identifies zero. Nope, they don't need any SSI because the amount that they get is way more than $783. But if somebody is getting a $400 SSDI check, then it's going to look like this. They're going to apply that $20 general income exclusion. Their countable income is going to be $380. When you subtract that from the federal benefit rate of $783, it identifies they need 403. They need 403 in order to live each month to get them to the basic amount of income that can help them to live. That's when somebody becomes a concurrent beneficiary. Oh, banana, you'll need that, write that down. That's your second word. Okay, so between that SSDI check and the SSI benefit that a concurrent beneficiary would get, it would be $803 because that person does get the $20 disregard for that unearned income, the SSDI. So if that person has no other income between those two checks, they would get $803 each month. So we have some good news for these individuals. The good news is that somebody who is getting SSDI, they're going to get the Medicare after a 24-month wait. If somebody is getting SSI, they're getting Medicaid here in South Dakota. And if you remember, I told you that if somebody is getting Medicaid because they're SSI eligible, then all of their Medicare costs are covered. They don't have any out-of-pocket costs for the Medicare Part B, Part D, any of those things, just the little tiny co-payments. And they're also going to automatically get the extra help to help pay their Part D costs. So this person, these concurrent individuals, they have the best medical coverage of anybody in South Dakota. Good news for these guys. The other good news is that these people have access to all of the work incentives. This person has access to the SSDI work incentives, the impairment-related work expense, the subsidy, and the unsuccessful work attempt. They have access to all the SSI work incentives, the student earned income exclusion, the impairment-related work expense again, the blind work expense, and the PASS. These concurrent beneficiaries are actually, benefit-wise, a perfect PASS candidate. Not all concurrent beneficiaries should do a PASS because they might not have a work goal and might not want to work themselves off of benefits. But PASS-wise, these guys are a perfect PASS candidate. The other good news is that these individuals have access to both of the medical coverage work incentives, the 1619B if they're getting SSI, and the extended Medicare coverage if they're getting the Medicare. So that's all the good news. But the downside is that these guys have to follow both of the different rules, the SSDI rules and the SSI rules. So all of their income from a job is going to affect their SSDI check one way. And all of their income from the job is going to affect the SSI one way. Those two programs do not work together. The only time that they work together is in that calculation, is in that SSI calculation with the unearned income and the earned income to figure out how much they need. That's it. So the downside is there's a lot of rules for these guys to remember, a lot of different rules. Oops, I'm gonna go back. So if somebody, well, actually I'll back up. So a lot of people that I work with who are a concurrent beneficiary also work with a Medicaid waiver program. So if that's the case, this person has a bunch of rules to follow for SSDI, a bunch of rules to follow for SSI, Medicare, Medicaid, and the waiver program, because there's rules for the Medicaid, or the Medicaid waiver program as well. So that person, if they're looking at going to work, they should absolutely sit down with a benefit specialist, because there's a lot of stuff to go over. They should sit down with us along with their entire team. But even to make this more confusing, I've also had somebody in a handful of people in that situation, concurrent beneficiary getting waiver services, and they want to get married. And so that is just a super exciting situation for somebody like myself, but nobody else. And it's absolutely possible more people are getting married, but they also need to sit down with a benefit specialist and their entire team. But yes, concurrent beneficiaries need a lot of help.
Okay, thanks, Rhonda. And while Bonnie pulls up the case scenarios, do we have any questions for Rhonda, either on Medicare and the work incentives, or anything with concurrent beneficiaries? And you can pull up the PowerPoint, Bonnie, and we'll just go over a couple of scenarios. We've got about 10 minutes left.
So I was going to ask you, if there isn't anybody on after us, if people have to go, can we go through all the case scenarios? And then is it possible to, that way they can go back and watch the recording?
Yeah,
is that
certainly
something?
Yep,
so that way we can, I'll try and go fast, and you know, but that way if I at least finish them out, then people could possibly see the recording. So okay, let's do some homework. You will want to maybe have a calculator as a little tip while you're doing this, unless you just want to follow along. So case scenarios. Number one, Jim is a 24-year-old individual who has been receiving SSDI for several years. In January of 2020, he was hired on as temporary help at a local retail store. He received one paycheck in February for $1,680, but it was for the last week in January and the first week in, there, that looks better. It was for the last week in January and the first week in February. Did he use any trial work months? And if so, list the months. So you guys can unmute or put it in the chat if somebody wants to kind of let you shoot out the answers here. I can't see the chat, so I see it flashing. So I'm going to go ahead and move on.
As January and February, one response says no, and
Yep.
I'll respond to the how you'll be able to access it to rewatch it.
Okay, perfect. So it says right here that we are able to prove with his schedule and the hours that he works that half of the check was the last week in January and the other half is last week in February. So in this case, we would use a really obnoxious color highlighter on the pay stub, and we would show that $840 of that should be counted in January. $840 of that should be counted in February. Trial work in 2010 or 2020 is 910. Boom, under trial work. Didn't use it because we were able to prove that that whole check should not be counted in February. So we're going to go on to 1B, and I see the years kind of got messed up here, but use the 2020 numbers for this example. That will help. Jim is offered a permanent job at the store and is now earning $950 per month beginning February 1st through April 30th. So then his earnings drop to $800 for May through September. Then October through December, his earnings increase to $100 or to $1,000. List his trial work months. So I'm just going to give you a couple minutes for those of you that want to try and just write down what months you feel are his trial work. And then I'm going to try something new here.
One person answered October through December 2019.
Okay. All right. I'm going to give it just a second here. And I like this Zoom, so I can do a new share. Hopefully you guys can see this. Here's Jim. This is what a trial work chart is going to look like that we're going to help you with. So what they just talked about right there is, remember February through April, and we're going to just go with trial work was in 2020 and it was $910 a month. So if you look here, they told us that it was February, March, and April, he was earning $950. Then it shows us, then it says it was only $800 May through September, and then October through December. So this is where it works. Just write it out each month, how much they made, and then start tracking. So this is how I would have done it if I was helping Jim. So the months of his trial work were February, March, April, and then October, November, December. I hope that makes sense. And I don't know if you're like me, but it helps me a lot to write it out in something like this. So
and a couple people did give those answers.
Awesome.
Bonnie.
Yay. Now I know how my teacher daughter feels when people get what you're trying to teach them. Okay, so next one, subsidies. Let's talk about Stan. Stan is starting a job and will be earning $1,300 per month in gross income. He receives an SSDI check. His SSDI is about $800. You talk with Stan and what he spends related to work and find out that he spends the following. So Stan's costs are $80 a month for transportation to and from work, payment to have the neighbor wake him up every workday, $100 a month, uniform dry cleaning is $60 per month, internet service to access a work computer at home, $45 a month, medication co-payments are $150. So if you haven't read ahead, this is all we know, right? So some of the questions, I wrote them down too, but what would we be asking? And I'm just gonna go ahead and kind of answer these for the sake of time. So some of the questions that I would ask Jim if he's sitting across. Is there public transportation available in your community for everybody with a disability or not? Because if it is, it probably doesn't count because you don't have to have a car to go to work. Now, do you use specialized transportation? Say you need paratransit or you live in a community to where there isn't public transit and you have to pay someone? Then there's a good chance that it's going to be an IRWI. Payment to have the neighbor wake you up every morning. That's actually a thing. So say you take a medication or you have a disability condition that alarms don't wake you up. And so if the only way you can make it to work on time is to pay someone to wake you up, maybe. Uniform dry cleaning, is it required for your job? And how does it relate to your disability? And then internet access to work, I'd maybe be asking, is that the only thing you use the internet for? And then medication co-payments, I think it used to be back in the day, they would say that the medication had to be related to your disability, but I think you just have to show that if you did not take the medicine, you wouldn't be able to work. And so I think that goes better. So let's move on with this one. So through follow-up questions, so through our conversation at the intake with Stan, Stan takes the bus to and from work. He pays the neighbor to wake him up every morning because the medications he takes cause him to sleep through alarms or fall back asleep easily. He gets his uniform dry cleaned often, so his appearance at work is extremely neat because he fears that having a mental illness is already one strike against him. He purchased internet service to work from home as he often is unable to complete paperwork on time, and he has trouble concentrating in the afternoon because of his medications making him groggy. His boss agreed that it's okay for him to access the computer system at night to complete paperwork and submit it the next morning. However, he also uses the internet for personal business, and his medication co-payments are for medications that treat his mental illness, and one is for high cholesterol. So, based upon this, which ones do you think are going to be IRWIs? And again, for the sake of time, I'm just going to kind of go on through them. If it's just the regular bus in town, transportation is not. And more we're seeing that transportation is not, especially like the communities I serve don't have specialized transportation. Paying the neighbor to wake him up? Absolutely. I would definitely be having that conversation with Social Security. The uniform, unfortunately, it's just his own personal feeling. It's not a requirement for the job. Uniforms, even if they're required, it still isn't an IRWI because everyone would probably have to wear them. It wouldn't be just because of him and his disability. He purchased the internet. So if you access it, there may be a percentage, but I think anymore with everybody having smartphones and Netflix and Facebook and Snapchat or whatever they all have, it's going to be hard to show that you only use that internet for work purposes. And then medications, definitely still have the conversation. I have someone that does have medication IRWIs, and they don't like pick them apart to see which one's the disability related, because okay, if you don't take your high cholesterol one, you're probably not going to have good health, and then you can't work. So I've not seen them nitpick that. So I apologize, I'm still kind of flying through these. We've only got a couple to go. Betty, let's talk about Betty, number 3. Betty is an SSDI beneficiary. She works and earns $10 an hour, 30 hours per week. She calls me in January, or calls you, her provider, and says because of her disability, she needs help with some of the tasks of her job. And so the employer is hiring her a personal assistant to help her 7 hours a week, and the employer is paying that person $15 an hour. We all need those employers. So what is Betty's countable income for Social Security purposes? First off, so remember what we do? 30 hours a week times $10 an hour times 4.33 equals $1,299. Okay. So we don't know, we can't really get into trial work or anything right here because we're going to assume that if they're looking at this, she's probably out of trial work. So then, IRWI or subsidy? A subsidy is when, a subsidy, this would actually be a special condition because, or no, this is a subsidy because the employer is paying that. The employer is providing assistance to her. So she would have a subsidy. So then, if we really want to talk about it, 7 hours a week times $10 an hour. The subsidy is how much Betty makes per hour, not how much is actually being paid to the assistant, okay? And I hope, like I said, you don't have to 100% know this. We'll help you with this stuff. So $70 a week times 4.33, you subtract that, you do that math, she's under SGA because she's only like $50 over. Anyway, so we know that. Okay, now same scenario, but she's paying the personal assistant. Well, if she's paying the personal assistant, we're going to assume she's paying that assistant $15 an hour. She is actually having $105 a week come out of her own money, remember, because the IRWI, it's because she's paying it that makes it an IRWI. Because she's paying it, so that becomes an IRWI. Everyone kind of with me so far? Okay, we're gonna fly right through to Janice. So, Janice is an Janice is an SSDI beneficiary living with MS. Her SSDI is $900 a month. She tells you she worked last year and she knows that she used 6 trial work months, and we were able to confirm that with Social Security by getting a BPQI. She's decided to work for her friend's business as an office manager and receptionist. Lucky for her, her friend is very flexible about how many hours she works, and she will be paid $15 an hour for her time. Janice will need assistance with filing and other physical tasks, about 5 hours a week. So Janice is going to pay her daughter's friend $9 an hour to assist her with this 1 hour after school. Janice also has medication co-payments of about $200 per month under her husband's employer health insurance plan. And we know these expenses have been approved as IRWIs by SSA, okay? Remember, they always have to have the last word. So let's move on. Story problems are fun, right? So beginning in January, Janice decides to try working only 5 hours per week, and her assistant helps her the entire time. First question, will she use trial work months? So let's talk about that. 5 hours a week times $15 an hour is $75 a week times 4.33 for our averaging purposes. And I get $324.75. Trial work is $910, so nope, no trial work. And since we know she still has a few trial work months left, the paying the assistant really doesn't matter, remember? Work incentives don't count during the trial work period. Social Security doesn't want to know. Well, what happens if she likes working and in March she increases her hours to 20 hours a week and the assistant's still with her 5 hours a week, and she continues that through December, okay? So first let's do that math. 20 hours a week times $15 an hour times 4.33 works out to be $1,299. Will she use trial work? If so, what are they? When is her EPE? Okay. Well, let's go back up to the top before we overcomplicate this. Remember how we said she has $200 of approved co-payments? We really don't even need to worry about the IRWI or the extra help. In my book, is the way I look at it. And Grace is grace period applicable. Calculate her monthly income during each relevant period as well. So I made up a quick little case scenario. Now this is what it would look like if I made up a trial work chart for her. So look at 2019. I'm just going to assume, remember how we knew that Social Security said she used 6. So I just put 6 in, just random, so we know she's used 6. Now she's talking to us in January of 2020. So remember those first couple months, we knew she only made the 324. It's not a trial work, doesn't count for anything. Now, March, April, May, well, we need to try and figure that out. We knew her gross wages are $12.99, but she's still got trial work months left. So doesn't matter. We don't need to use any of the work incentives. So boom. Oh, so May of 2020 is trial work month number 9. Starting in June, in the back of our mind, we know, oh, we got these IRWIs. She's over SGA because she's $12.99, right? But we have a $200 IRWI already approved by Social Security. So that has our countable income reduced down to $1,099. And so under benefit status there, what I didn't fill in and I should have, it should say check, 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 check. She gets to keep her, what is it? What does she get? Her $900 a month plus her $12.99. Perfect example of we never want someone to say I can't work because I'll lose my benefits. This is awesome. Janice is in a great situation here. So give you some, just know that you can go back and look at this on the recording. And so then the next part of it is in January, I'm going back to this scenario. So if you look on your scenarios, in January of the next year, she has to stop working because her daughter has a car accident and needs assistance during the day. So she reports to Social Security. What happens? So we're thinking of January of 2021. Now I know where you're all going with that. You're thinking, well, she would need to apply for expedited reinstatement because she quit working, but it's not related to her disability. It's because of her daughter. Well, but wait, we're kind of overthinking. She's still in her EPE. Really doesn't matter why she stopped working here, right? In January of 2021. Because if you look, I'm going to scroll it down a little bit. The 36 months of the EPE that started, that doesn't end until May of 2023. So like I said, don't get too worried about if this isn't perfectly making sense to you. This is where we come in, but we will actually make one of these for the beneficiary with the report. So just so you see this. Grace period, nothing happened because we were able to use our work incentives to get her countable earnings under SGA. So that perfect reason, but we don't like it when someone calls and says, well, what's SGA? We don't want to tell you the number. Each situation, that number looks different. Maybe we can find ways to get it down. So that's the last Social Security one. I'm going to go back. I'm going to leave this up for just another second while I get the new share. So we have one last story problem for you. And it is, there they are, sorry. The very last one, bringing it all together. So now you've learned about SSI, SSDI, Medicare, and Medicaid. Now we bring in William, because guess what? We have lots of out there that they receive it all. And when they get it all, they have to follow all of the rules. They now have to follow SSI and SSDI. So William is 18 years old and he receives, his SSDI is $400 a month. He has never worked since receiving benefits. Assuming he meets the requirements for SSI, what should his SSI amount be? Okay, so I didn't bring up a chart for this. I should have. So the $400, if you still have your SSI calculation sheet, this is where we would pull it up. And I will show you, just bear with me. I did one for the whole story, and I'll show you what would happen if we didn't have earned income. I can do that. So William decides to get a part-time job in January. He's going to earn $13 an hour at 24 hours a week. He's going to have specialized transportation to go to and from work. VR is going to pay a job coach because VR is great about that. So just see how this guy's got everything going on right here. So step by step, first we calculate how much is his earned income. $13 an hour times 24 hours a week equals 312 times 4.33, $1,350.96. That's his income. Okay, so calculate his new SSI amount, his trial work period, his grace period, and his extended period of eligibility. So right off the top, let's just go into SSDI world, okay? Remember, $1,350 was his earnings, right? We already know we have a $200 medical early right off the top because we're going to go ahead and say that Social Security approved it, okay? So $1,350 minus 200, we're down to $1,150. We're under SGA, okay? Step number one. But VR is paying that job coach. So now we still have a subsidy. That subsidy is 5 hours. I just had a thought though. If he still hadn't ever worked, he's still got all 9 of his trial work months left, right? Because we don't care about subsidies and all of that. So let's say he got out of his trial work. Let's go there. And he got into his EPE. With the 2 subsidies of, or the 2 reductions of the IRWI of the medical and the subsidy of VR, we're able to get his countable earnings down. I calculate it down to $869. So anyways, he's not going to lose that. I wanted to pull up a I don't know if you guys can see this very well because I'm not as great as Brad is at bringing this all together and making this, but Rhonda, can you see this okay?
I can see it.
Okay, I can see your face. I want to make sure you could. So here's what I did with William. So this is how we do the calculation sheet if someone has both, okay? So up in the top is the unearned income, right up in here. So there's the $400, we subtracted $20. His countable unearned is now $380, okay? So we have that in the back of our head. Now we move down to the next section. We calculated that he earned $1,350.96 from his paycheck, okay? We can't subtract the general income exclusion down here because we already used it up here. You can only use it once. But since so now that he's working, you know, we're so nice. Well, we're going to let you keep $65 of that right here. So now that's reduced us down to $1,285. But remember, we have that $200 IRWI. Subsidies don't count in the SSI world, but IRWIs do. So we know we have that. So now that brings it down to $1,085, okay? You divide that by 2 and you get $542.98. Now, you take his countable earned income from up here, you bring it down here and you plug it in, and then remember he's making like $1,300 bucks, but we're only going to count 542 of it. So then we add those 2 together and we come up with $922.98. Now we know that SSI for this year, if it's a base rate, if they're just using that amount, we know, I'm pointing, you can't see me point, we know that it's 783. Well, if you subtract 922 from 783, you know, we know that's 0. He's not going to get paid any SSI money. Okay, makes sense. So, but let's look at that. We always like to show the total picture. Even though his SSI is 0, he's still getting his $400 from SSDI, because we know by doing the other math that he's going to keep getting that because of the SSDI work incentives, right? He's under SGA. So then bring in his paychecks of $1,350. We do have to subtract out because he is paying that $200, that is coming out of his check. So for budgeting purposes, he still has $1,550.96 a month, which is much better than if someone were not working and trying to live on $783. So the vast majority of the time, by meeting with a benefit specialist, we can show you that working is money ahead. And I guess that's a 2.5, almost 3-hour lesson that we would love for you to take away, is that yes, you can work, and yes, that does not mean you'll instantly lose your benefits. So do you guys have questions, quick questions on the calculations? I know I went fast. You are welcome to reach out to us on those. I will stop sharing. Okay. Phew, sorry, I didn't mean to go so fast through there, but we wanted to make sure that we got those in.
If anybody has any other questions, definitely unmute yourself and let us know.
Yeah, please let us know if Brad or Rhonda, I can't see the chat, but like I said, apologize for going over. We shove a lot at you for this. And this section is probably our longest one in our all-day training, where the other ones are shorter. So it's hard to balance them.
I did answer some questions that were in the chat box. If anybody has any others, you can put it in the chat box, or you can unmute yourself and just ask us. We're all done now. We have all kinds of time to answer questions.
Yep, I'm reading through them. Someone wants a blank SSI calculation sheet. It looks like Rhonda's going to let Tynell know. Heather asked a question about, she said, so if the employer and VR pay the subsidy as it reduces the countable income with SSI or SSDI. Subsidies only count for SSDI. And that's where the concurrents get complicated. And so, and remember, they won't even look at a subsidy until after you've used all of your trial work. So, and remember that in the handouts that Tynell sent you, she did send you our contact information for all of us. Brad is on there in the background. He's kind of our technical guru. He covers Brookings, Watertown, Aberdeen, everywhere. I think our emails, and a lot of us have Google numbers working from home or things like that. So we are definitely accessible. Please look at that unemployment effect on benefits sheet that we did and sent out. Things are different right now. So I'm not seeing any more questions. Oh, what was the first word? The word was rock, and what's the second one?
Banana.
Banana. Rock and banana are
There
going
was
to be.
a question. What was the third word? There was just two.
There were just two.
Rock and banana. That's all you need to know.
So if there aren't any more, that's all we have for you guys.
Oh, there's somebody who is trying to talk.
Yes.
Oh, there you
I
are.
put in the chat box that I was wondering how you rewatch the recording. Does that go out in an email, or does the link work to watch the recording?
I think the recording, I do remember Brooke saying that they are going to put it on our website. So bsnsd.org. That stands for Benefit Specialist Network South Dakota. Or on the Facebook page. Make sure, if you want to watch the recording ever, email any one of us and we will get it to you if you have trouble finding that. I still have a Facebook page. I'll put a plug out there for that. Same thing. We like to put some scenarios out on there and announcements on there, so you may want to follow that on Facebook.
Perfect.
Thank you. So Hopefully we will see you next week. If you haven't registered yet, you should have been emailed the link, and we will get into all of the other benefits that aren't just Social Security that people need to be mindful of. So, and hopefully next year we are back in person. My social self is ready for in-person trainings, so. All right, thanks everybody. Thanks for coming.